Welcome to the news on NTA International. This news can be watched on the various social media displayed on your screen. I am Vivian Izadefe. Let's start with the headlines. Experts advocate improved awareness on autism. United States pledges support to Nigerians' fight against terrorism 10 years after Chibok girls' abduction. Plus, expected rise in oil prices after Iran's attack on Israel tightens. The United States government has pledged support to Nigerians' fight against terrorism as the country marks 10 years of the abduction of more than 200 schoolgirls in Chibok, Borno State, northeast by terrorists. This is contained in a statement issued by the spokesperson of the U.S. Embassy, Aisha Gambari, in Abuja. Gambari says the U.S. would also support Nigerians' terrorism survivors and their families, noting the U.S.-Nigerians partnership was built on the foundation of shared values and common goals. She observed the United States will continue to support Nigerians' effort to combat terrorism and to hold perpetrators of terrorist attacks accountable, as well as guarantee citizens' safety and well-being. On the 14th of 2024, Boko Haram terrorists stormed Government Girls Secondary School Chibok in Borno at night and abducted no fewer than 276 girls. The girls were preparing for that year's Senior West African School Certificate examination. A decade since then, while some of them were found, about 89 others are yet to return. Nigeria has become the first country in the world to roll out a new 5-in-1 vaccine called Men5 vaccine, recommended by WHO to protect people against 5 strains of meningitis bacteria. A statement by WHO indicates that the vaccine and emergency vaccination activities are funded by Gavi, the vaccine alliance, which funds the global meningitis vaccine stockpile and support lower-income countries with routine vaccination against meningitis. The WHO Director General Tedros Ghebreyesus, who said Nigeria is one of the 26 meningitis hyper-endemic countries in Africa situated in the area known as the African Meningitis Belt, described Nigerians' feat as historic. The Nigerians' rollout, he noted, brings the country one step closer to WHO goal of eliminating meningitis by 2030. The coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pati, says this vaccine does not only provide health workers with a new tool to stop the outbreak, but also puts the country on a path to eliminate particularly the states of Jigawa, Bauchi, and Yobe that were badly hit by the deadly outbreak of meningitis. Experts are advocating improved awareness on autism while preaching inclusion to make the most of the talents and skills of autistic persons. This was at a campaign in Abuja by the RBM Autism Foundation in commemoration of the Autism Awareness Month. Victor Azul was there and now reports.
Autism spectrum disorder is a neurodevelopmental condition that is said to affect about 168 million people around the world. In Nigeria, a speculative 1 in 150 children has autism. Limited data collection and awareness in the country explains why statistics can be challenging to pinpoint. Drawn to advocacy by the loss of a loved one to autism, Maria Okafor is one of the few creating awareness and advocating improved care for autistic children.
I noticed the gap, the lack of awareness in the society. I feel like a whole lot of people do not understand what autism means. Like, there's so many misconceptions that needs to be clarified and needs to be spoken about, and that's what we intend to achieve.
In commemoration of this year's Autism Awareness Month, The Ria by Maria RBM Autism Foundation is calling attention to these lifelong developmental disorders and how to support and get the best out of autistic children for the benefit of society.
By fostering acceptance, understanding, and support, we can create a more inclusive world where individuals with autism are valued for who they are.
You have that power to change your attitude, to impact your community, and to raise a productive and happy member of society.
Finally, an opportunity for guests to let go of loved ones lost to autism, but vow never again. In Abuja, Victor Azu, NTA News.
The World Health Organization WHO released updated guidance which recommended that implementation research be conducted in countries considering a transition from iron folic acid IFA supplementation to multiple micronutrient supplementation MMS. In line with the WHO's recommendation in 2021, the Nigerian Federal Ministry of Health approved the use of MMS during pregnancy and called for implementation research on the updated national guidelines for the prevention and control of micronutrient deficiencies in Nigeria. These experts say will curb malnutrition issues as well as reduce the rate of maternal and under 5 deaths in the country, as MMS reduces the risk of low birth weights by 13%, the risk of being born with small gestational age by 9% in comparison to IFA. Research shows antenatal MMS, a daily dose of 15 vitamins and minerals, is just as effective as IFA in preventing maternal anemia and more effective at improving birth outcomes. However, to maximize the benefit of MMS, pregnant women must adopt the practice of taking MMS daily throughout pregnancy, often preferred to as adherence. There are reports that pregnant women who receive adequate quantities of maternal micronutrient supplements do not always consume as recommended. This adherence gap, experts say, is hindering program effectiveness and ultimately its impact on women's nutrition. More reports when we return. Stay with us.
Fellow Nigerians, it is a good thing to be Nigerian. Good news! The Office of the First Lady of the Federal Republic of Nigeria is organizing the National Fabric Competition, the hashtag One Nigeria Unity Fabric Competition. The aim is to create a fabric design that would be indigenous to Nigeria, showcasing our culture and unity. This competition is looking out for creativity, concept, and the message of unity. Open to Nigerian youths, both male and female, between the ages of 15 and 25 years. And guess what? You can apply wherever you are in the world as long as you are Nigerian. The winner of this competition goes home with a cash prize of 25 million naira. Are you sure I will not apply for this competition? Submission of entries close on Sunday, 30th of June 2024. Submit your entries by sending pictures of your designs via email to unityfabric.ofl24@statehouse.gov.ng, making sure you capture all parts of your designs. Together, let us unite Nigeria!
From the boardroom at the Broad Street in Lagos to the main street of Kano and Nembe Creeks in Bayelsa.
Thousands of people have taken to the streets in the Nigerian capital of Niamey, demanding the departure of American forces stationed in the northern part of the country. The move came after the Nigerian authorities cancelled the cooperation agreement with Washington last month, which dates back to 2012. Justin Binwi reports.
Reports say the demonstration was called by Synergy, a group consisting of about 10 associations that support the Nigerian authorities and local Islamic organizations. Crowds gathered in front of the headquarters of the National Assembly in central Niamey, where several figures attended, including the junta's official spokesperson, Colonel Amadou Abdurrahman. Many students participated in the demonstration, during which protesters chanted, "Down with American imperialism, long live the Sahel Coalition, Mali, Burkina Faso and Niger, and the liberation of the people follows their path." After the expulsion of the French army at the end of 2023, Niger announced last March that it was abandoning with immediate effect a military cooperation agreement with the United States dating back to 2012, considering it illegal. Niamey then confirmed that the United States would soon present a draft on the withdrawal of its soldiers.
We asked the Americans to remove their soldiers from our country. We realized that they too are not serious.
Washington did not want to comment, simply stating that it had contacted the authorities in Niger to obtain clarification. It is noteworthy that about 1,000 American soldiers are deployed in Niger, and they have a large base for drones in Agadez, northern part of the country. Justin Bemunyi, NTA News.
In a concerted response to the growing threat of monkeypox virus, also known as simian pox, Africa is mobilizing to strengthen its response. Nearly 250 experts gathered in Kinshasa, Democratic Republic of Congo, under the aegis of the World Health Organization and African Center for Disease Control, to develop strategies to stem the spread of the disease in the African region. Details with Justin Bemunyi.
The situation is said to be alarming, with over 92,000 human cases reported in more than 110 countries. In 2023, the DR Congo was one of the hardest hit countries, recording 14,600 cases and 654 deaths. For Professor Jean-Jacques Muyembe, renowned virologist and co-discoverer of the Ebola virus, the urgency of the situation is clear.
Just recently in the DRC, for the first time, we observed sexual transmissions of monkeypox, the Central African species. And so, if we take this sexual heterosexual transmission, we take the severity of this disease, and almost every province will be affected. It's a public health emergency.
In their fight against the epidemic, the experts pledged to coordinate their efforts in diagnostics, laboratory optimization, and vaccine research. Dr. Ngash Ngongo, Chief of Staff and Head of the Africa CDC Executive Office, stresses the need to facilitate the strengthening of preparedness and response capacity to mitigate the impact of monkeypox in Africa and beyond. Enhance effective surveillance, national laboratory capacity, rapid epidemic response, and engagement with affected communities. The forum believes every day counts in the fight against mpox, and there is an urgent need to improve the effectiveness of the response to this epidemic. And this is the reason health ministers of 12 African countries have decided to work together to create an action plan to combat mpox. The plan includes measures to prevent, detect, and control the spread of the disease, protect African populations, and ensure a safer, more resilient future for all. Justin Bemunyi, NTA News.
We earlier took a report on the multiple micronutrient for pregnant women. However, how to maximize the benefit of MMS, pregnant women must adopt the practice of taking MMS daily throughout pregnancy, often referred to as adherence. And joining me now via Skype to speak more on the newly approved multi-nutrient supplement for pregnant women is the is the Program Officer of Civil Society Scaling Up Nutrition in Nigeria. Hope Ikani. Hope I got your name right. You're welcome. Good to have you join us in our studios.
Thank you so much. Good evening. Good to be here.
You're welcome. Can you tell us about the CS Sons journey over the past decade and what the organization has achieved for nutrition in Nigeria in terms of nutrition outcome?
All right. Thank you so much. Civil Society Scaling Up Nutrition in Nigeria, CSON, has been in existence for the past 10 years. And over the past 10 years, just to keep it really short, some of the things we've done is that starting off in coalition building, we started with 7 members, but now we've grown to over 512 members in 29 states in Nigeria, where we have state chapters. And one of these strong things that I would say CSON has done over the years has been nutrition advocacy. We've been at the forefront of nutrition advocacy in Nigeria, from advocating for the creation of nutrition department to 6-month extension to 6 months maternity leave in Nigeria, and increased funding and allocation for nutrition activities in Nigeria. These are some of the things we've been doing over the course of 10 years in Nigeria. And also some other things we do is capacity building and service delivery, among others. So let me just keep it short because of time we have.
Micronutrient supplements play in improving nutrition in Nigeria, especially among vulnerable populations.
All right. So basically, iron deficiency is one of micronutrient deficiency, and iron deficiency leads to anemia, which is very common among women of reproductive age in Nigeria. So you have 58% of women of reproductive age in Nigeria being anemic, and then you, according to the NDHS of 2018. And then you have 68% of children under 5, which are also anemic. And you know, micronutrient deficiency is a form of malnutrition. And one of the things we are looking at is MMS, multiple micronutrient supplementation, which can be used to combat this hidden hunger, because MMS contains 15 vitamins and minerals, and which include folic and iron and folic acid in the recommended dosage, which I think is one of the key things that is being used in fighting this hidden hunger known as micronutrient deficiency, which can be very impactful in improving nutrition outcome for children, for women, and therefore their children in Nigeria.
So how has then CSON contributed to the adoption and implementation of MMS programs in Nigeria in terms of awareness and uptake?
Okay, thank you. So CSON, like I said initially, we're very good with nutrition advocacy. One of the things we try to do is legislative advocacy. We're trying to see how we can engage legislators, to see how we can talk on improving funding for MMS. You know, we're trying to see how the Federal Ministry of Health is trying to see how we transition from iron folic acid to MMS, and we're trying to see how there can be adequate funding for that. Another thing we do is we leverage on the child nutrition funding by UNICEF, where they match fund whatever state government bring out for nutrition commodities, and their minimum is 100,000 naira. So this is part of the advocacy, $100,000. This is part of the advocacy we do from state level, trying to talk to governors to bring out over $100,000 for the UNICEF child nutrition funding so that they can match it. That's one of the things we do. We also do town hall sensitization meeting, trying to talk to pregnant women and engage them at primary healthcare level to say that, this new product that is coming to the market, it is well received and they should have no cause for alarm. It's just like the iron folic acid, it's just a better version. And then among other things, we try to do media awareness, social media campaign on the impact and usefulness of MMS. So these are some of the things that CSON have been doing and are still going to be doing in the transition from IFA to MMS.
So what are the challenges or gaps in the adoption and scale-up of MMS in Nigeria, especially on hard-to-reach areas?
Yeah, so some of the gaps we can see is one, costing and the price. Compared to IFA, it is more. It looks like it's more expensive, but it is not, because it contains 15 vitamins and minerals, while iron folic acid just has iron and folic acid, while this has 15 different types. And so that would pose as a problem, but we're trying to engage with the government to see how these commodities can be subsidized, for people, for it to be reachable primary healthcare centers. We also the issue of availability of products, trying to, just the same way the RUTF, ready to make therapeutical food for children, we're trying to see how local manufacturers can be able to tap into this and work with them to tap into the UNIMAP and UNICEF formulation, WHO and UNICEF formulation for MMS, and see how we can produce these things locally to beat down the pricing of this thing. And another thing can be adherence. Another challenge we can see is adherence. It's a new product. It's not different from what has been, not so different from the iron folic acid that has been around, but we have to make sure that adherence at the primary healthcare center is being taken, which can pose as a problem, because if it's something they're not used to, a lot of people will not want to take it too. We see that as one of the challenges that we could have for the MMS uptake.
All right. Thank you, Hope Ikani, for your insight into the MMS program.
Thank you.
All right. Now to other matters. 18 countries across Africa have recorded a significant rise in cholera cases over the last 2 years. According to the World Health Organization, 5 of the countries have been identified as acute crisis.
The World Health Organization reports that cholera epidemics are returning in the southern part of the continent, which is currently in its wet season. Now, many communities are experiencing landslides and floods as a result of increased rainfall, conditions ripe for the spread of cholera, even into places where no new verified cases have been recorded. In week 10 of 2024, 8 countries, Burundi, Cameroon, Comoros, Ethiopia, Malawi, Tanzania, Zambia, and Zimbabwe reported a total of 2,242 new cases. Since the beginning of the year, the number of cholera cases and deaths reported to the WHO Regional Office for Africa as of 10th March was 51,998 and 1,118 deaths respectively. That is a case fatality ratio of about 2%. 5 countries have been identified as having acute crisis: the DRC, Ethiopia, Mozambique, Zambia, and Zimbabwe, and they account for more than 95% of both the total cases and total deaths this year. To cap these numbers, UNICEF has facilitated the delivery of over 26 million OCV doses to 8 priority countries with high cholera burden in the region: Ethiopia, Kenya, Malawi, Mozambique, Somalia, South Sudan, Zambia, and Zimbabwe.
Stakeholders have continued to express confidence and hope on President Bola Tinubu's vision that is already transforming the country's prosperity through his renewed hope agenda. They conversed on Kaduna at a dinner organized by the Nigerian Institute of Public Relations, Kaduna State Chapter, to honor the Minister of Information and National Orientation, Mohammed Idris. Saliu Banara reports.
It was a merry-making event that metamorphosed into a speech-making one, where friends, associates, and fellows extol the roles of their colleague, the Minister of Information and National Orientation, Mohammed Idris, during his days as the 5th chairman of NIPR in Kaduna and his membership of the Institute for more than 30 years.
I bring you greetings from your very good friend, Senator Obosai, and I want to congratulate the Institute here for having a very fine gentleman.
One issue that I would like to say about the Honorable Minister is his capacity to mentor people, and I am an example of that.
By inclination,
and by training and by breeding, is a peacemaker.
Mohammed Idris was one of the strongest pillars that backed me to attain the little success that we are being applauded for.
At a time like this, there is nothing better than telling Nigerians the truth. And that has been the cardinal principles of the Minister of Information and National Orientation.
These efforts the government image maker promised to sustain and explore with a commitment to upholding transparency in public communication to build trust.
The president didn't send me as minister to come and lie to Nigerians. What he has said is that I should come and explain to Nigerians, tell Nigerians what government is doing, and also take feedback from Nigerians to government so that government will be better informed. And you can see what we have done. We started this town hall meeting. We were in Kano, we met with the business community on live television. We were in Jigawa, we went to our local government on the farm and had a town hall with the farmers. The president will return greener pastures to all the nooks and crannies of this country so that everybody will find his feet and then will find prosperity.
The renewed hope agenda, he assured, means well.
If you are looking for one reason why fuel subsidy had to go, my one answer is that we are consuming nearly 2 billion liters of this thing, the PMS called petrol, 2 billion liters. Now, when fuel subsidy was removed, it came down by about 50%.
As a fellow of NIPR, he promised to remain a worthy ambassador of the Institute. In Kaduna, Saliu Gonara, NTA News.
And now to weather updates. This is where we end the news. Thanks for watching. I am Vivian Izadefi.